There they are again. Wednesday is going to be the big day for JCPS. The school buses will be rolling early that morning. The back-to-school excitement and nervousness returns for the kiddos and the parents. The start of school for JCPS students and their families. Thousands of folks in a new year can be a bit overwhelming, from buying school supplies to scheduling those checkups to getting your kids back into a routine. There's a lot to juggle for the parents. Joining us now here to talk about it live at 4 o'clock is Dr. Ricardo Ferreira. He's with Kentucky One Health. And Dr. Ricardo Ferreira, excuse me, I want to get your name correct here.
That's correct.
And also, let's talk about immunizations.
That would be great.
That is one thing parents really have to have had scheduled so far. Wouldn't you agree?
I agree 100%.
So how many immunizations do we need these days?
Well, we follow direction from the CDC, which this goes by ages, and each age goes with, gets different shots, you know. Some shots are required, some of those are recommended, and obviously they keep changing depending on how old the kid is, okay? The whole idea on shot is to prevent anything on the child that in the future can happen, and not only protect the child, but protecting everybody around them.
What are the top ones you need these days?
Right now, the big one and the big change right now is the hepatitis A.
Yes.
That was not required before, and now it is.
Is it easy to get? I mean, I've had a hard time finding it.
It is quite easy, and actually, not only for kids, but everybody can get it. So,
let's talk about the need for sleep. A lot of students get on those school buses so early at 6 a.m. They are active in their athletic pursuits and also doing the homework.
Yes.
How do you emphasize get to bed early?
The need of sleep is vital. I mean, if you don't have enough sleep, you won't be doing good at school, can affect your behavior, or it can cause cognitive changes. So the whole idea is a kid that need to sleep between 10 to 11 hours, which is recommended. Try to avoid any kind of caffeinated drinks within 6 hours before they go to sleep, and obviously no video games, no TV at least 2 hours prior.
More than 10 hours, you know most kids aren't getting that.
I know it's difficult to get into a routine. What you need to do is do it early. Don't wait until the last day before you work on this. Try to do a few weeks before, and try to maybe go to sleep a little 15 minutes earlier and get up a little earlier either.
And try it. They'll feel a lot better, and they can also focus on their studies with a lot more sleep, and they're not cranky.
Yes.
Food allergies, they seem to be growing and expanding in their scope. What do you see? What's the top one, and how should schools and parents deal with it?
Once we do the physical exam, we review what kind of medication they're taking, what kind of allergies they have, and in case that they happen to have allergies to sometimes food that can be offered at school, we try to fill a little form that we provide to the school, certifying what kind of food they need to avoid, and if they accommodate the patient or not. On more severe cases, we also provide EpiPen just for emergencies.
The EpiPen, of course, but we've been just doing stories on how difficult it is to get right now. Where does that stand in your mind?
Right now, I have not been having much of a difficulty. So far, the insurance have been paying, so have been all going through.
Have you had to ever treat a young person who's come in from school because they got a hold of some kind of food that triggered it?
I did have a few cases.
Yes. So it's possible for it to slip through.
Yes, especially with peanut allergies and sometimes strawberries.
All right, Dr. Ricardo Ferreira, thank you for coming in.
Thank you so much for inviting me.
Kentucky One Health.
Thank you.
Great reminders that we all forget about the last 3 months as everybody's been swimming and on vacation and have a lot of fun. All right, thank you, sir.